My name is Jennifer Hessler. I am a naturopathic doctor at the Maple Shores Health Center, and I spend a lot of time educating patients about the relationship between their health and the health of their environment. This area is a passion of mine. I did my undergraduate degree at Queen's University in environmental science, and after I completed my naturopathic medical degree, I did further study with Dr. Walter Crinnion, who's an expert in the area of environmental medicine. So it's something I feel very strongly about. Often people are not aware of how much the health can, or the environment can affect their health. One of the first areas that often presents with symptoms is the immune system. So people will start to get sick more often. When they do get sick, it's harder for them to recover from these infections. They can develop allergies, asthma, skin conditions. And then later on, it can go on to present with different kind of hormonal issues. So thyroid problems, infertility, premenstrual symptoms, menopausal symptoms. And then in more extreme cases, when people's bodies are really overwhelmed by toxins, we start to see neurological symptoms. So sometimes it can mimic multiple sclerosis or Parkinson's disease. So definitely there's a wide range of effects that environmental toxins can have on our bodies. So people often have the impression that there's not a whole lot that they can do to change what they're exposed to. They think that these things are released by industry and it's in the air, and what can I possibly do to change that? But studies have shown that we can actually make a very large impact, regardless of what area we live in, by changing what we do in our homes and changing the food that we eat. So one thing that I often talk to patients about is looking at the products, the personal care products that they're using in their homes. So cleaning products are a very big exposure. They're full of phthalates and parabens and lots of other chemicals that affect a lot of areas in our bodies. And good old vinegar and water and baking soda can do just as good a job, if not better, without having that effect. A huge source of toxins in people's homes, which is surprising to a lot of people, is air fresheners. Studies have shown that the number of toxins in a person's home drastically go up depending on the number of air fresheners that they have in their home. And again, it goes back to this perception that clean has to have a smell. Clean should smell like nothing. And if people do want their homes to have a scent, then using things like natural essential oils can do a really good job without having any of those harmful effects. Another tip that I'm always telling patients is the use of fabric softeners. Instead of using these scented fabric softeners that are Spring Breeze or whatever they are that are out there, good old vinegar works great, doesn't make your clothes smell like vinegar, and doesn't release anything into the environment at all. And beyond what we're using in our homes, what we're putting into our bodies is a huge thing too. So we can influence the amount of chemicals based on the food choices that we make. So the Environmental Working Group has created a list, each year they update it, called the Clean 15 and the Dirty Dozen. So the Clean 15 are the fruits and vegetables that contain the least amount of pesticides, and the Dirty Dozen are the ones that contain the highest amounts. So people will often ask, well, do I have to eat organic all the time? If you can, it's definitely helpful, but if you're looking at where to spend your dollars, eating organic from the Dirty Dozen is where you're going to get the most bang for your buck. And these changes definitely do make a big difference. There are many other things that I can discuss with patients that can help, but we can do a very simple urine test in the office that looks at the levels of many different chemicals. And I know that by encouraging them to make these changes, when we retest down the line, that the levels will show up as being much lower. So, and ideally, what we want to do with naturopathic medicine is focus on prevention. So we don't want to wait until people come in with symptoms and then have to work on correcting them. Ideally, it's beneficial for everybody to make these changes and prevent those things from happening in the future.